Prescription for Life is brought to you by Suretime Emergency Medical Services. Worry less, live more. Call 906-SURE.
Suretime Emergency Medical Services, your 24-hour ambulance emergency service and medical center. Visit us at 10 Trafalgar Road, Kingston 5, or call us at 906-SURE. That's 906-7873. For ambulance services, medical coverage at events and medical house calls. Make your appointment today. Suretime Emergency Medical Services. Worry less and live more. Call 906-SURE.
This is Prescription for Life here on Nationwide 90 FM, brought to you with the kind support of Suretime Medical. They're at 10 Trafalgar Road in New Kingston. You can call them 394-5433. That's the 24-hour lifeline. And you can also call them on 906-7873, Suretime Medical. They facilitate 24-hour, well, they run a 24-hour medical facility. Any concern you have, any problem you have on the medical front, they are the people to call, especially in a time of need. You can call them at any time and they can dispatch an ambulance to come and attend to you or your loved one. If you're having an event, if you're hosting an event and you want the kind of coverage to give you peace of mind in the event that the worst happens, Suretime Medical, they are in the business of doing that. And you can't find a more professional group of people to cater to your health and wellness needs. My name is George Davis and I'm here working alongside Dr. Andre McDonald, who is wearing his Juventus jersey this evening. He's a man of many jerseys in the way that Joseph is a man of many coats. Good evening, Doc.
The last time, George, Joseph had to flee and he had to leave that coat.
but hold on, Doc, you didn't realize me I tell life on Joseph. Joseph never had many coats, he had one coat in many colors.
Exactly. And he had to run, George.
Yes, sir.
And he had to flee from that coat. He had to leave
it behind
in a very precarious position.
Yes, indeed, sir.
And that coat would have cost him. From his house straight into another man's house, it would have cost him many years of his life.
Yes,
From a teenager until he was over 30.
There
George.
you go. And Doc knows the Bible very well, listeners, so just work with him, yes? This evening, Doc, we're dealing with the issue. Usually, the topics that we deal with have, I don't want to say common name because, of course, this is medicine, and medicine deserves the world of respect, but usually the topics we deal with have a working name that, you say, okay, call it that. And it also has a scientific name. This topic this evening doesn't really carry a scientific name to declare what it is. It's just simply leg cramps. We're talking this evening about leg cramps. I'm certain Doc will say, yeah, George, but the scientific reference to cramps in the leg is so and so and so and so and so. But just the same, the working title, the working designation of leg cramps is leg cramps. And that's what we're going to talk about this evening.
I agree with you, George. And usually before we come to this program to talk to the nation about a particular topic, George, we would sometime refresh our memories all the time, George, and we look at journals and studies. All of them refer to it as leg cramps. You're absolutely right. There's no big name for it. They refer to it as leg cramps. The listeners refer to it as leg cramps. Your producer did ask you, Latoy, to ask the nation some of the topics they wanted to discuss.
Yes.
And this is a very common one, George. And so we're responding to the nation tonight.
Excellent. It may seem like a trivial thing, but Jamaicans, on the whole, have trouble distinguishing between their leg and their foot. So there'll be a cramp in the foot, there'll be a cramp in the leg, but for Jamaicans, it's all just leg cramp. Once the cramp is anywhere from the hip to the toe, they say foot. Foot or cramp.
And they're going to be right tonight, George, because even though the topic is leg cramps,
yes,
some of the times it occurs in the thigh,
yes,
which is that section that is between the hip and the knee.
Yes.
And some of the times it will also happen in the foot, which is that section below the ankle joint.
Yeah, between the ankle and the toe.
Yes.
That's where the foot is.
Yes,
There you
yes,
go.
yes.
All right, so let's talk about leg cramps. I guess a first question to ask is, how prevalent is leg cramps in people? Do people who are athletic get leg cramps? Is it them alone who get leg cramps? Are men and women of a certain age more prone to leg cramps? Do children get leg cramps? I want to see what the literature and your experience says about all that.
Well, George, we're going to give you the facts and the figures, but it's a very important question to ask. One study said almost everyone will get some sort of a leg cramp. And because leg cramps have a broad definition, it is going to involve the thigh, it is going to involve the leg where the calf muscle is, right behind at the posterior, the back of the leg, and it is going to involve the foot. So when they say leg cramps, they're talking about all three areas. I tell you, one of my patients came to me, George, because he had what he called leg cramps or muscular contractions in the right lower limb. And remember, you said it perfect. Jamaicans call everything the foot.
Yes.
So when he came to me, he said, "Boy, I thought me just have some cramps in my foot." And he said these cramps were cramps he could not control. These cramps were daytime and nighttime cramps, and they were unbearable, they were painful, they were frustrating. He's a patient of mine. He's listening tonight, that went overseas for a couple of years. I hadn't seen him for about 4 years. Loves his exercise, loves his sports. And he came and said, "No, you have to do something about this." No, this man is not known to have any chronic illnesses, George. The nurse did his blood pressure and it came back elevated. Not only elevated, but significantly elevated. And so because of that, we decided that we were going to do a heart test that we call the ECG. The listeners would have remembered it. We have been talking about it every week. We decided we were going to do a kidney function test, and we decided we would do his glucose and cholesterol profile. Look at his sugar, look at his cholesterol. Lo and behold, the only thing that was normal was his glucose profile, his sugar. Everything else was abnormal.
Yes.
His ECG came back abnormal. His kidney function test, his sodium, potassium chloride were all out of range. His cholesterol was also very high. And so here it is that we said to him, we know you came for leg cramps, but it seems to me that you have some other significant challenges. His presentation, George, was leg cramps, but it turned out that he had a lot of other abnormalities. This is a big point that is going to be driven home here today as to how leg cramps and the symptoms thereof usually points to something greater. Of course, still with me, still a good patient. We were able to resolve the leg cramps, and I'll talk about that even more later during the program. But I want to say that the questions you ask are significant. Adults tend to have most of the leg cramps. It's just in 7% of children. So 93% of the times you're going to find it in adults. So it's mostly in adults, right?
Yes.
Women tend to have it more for many reasons we will discuss later. But it is almost 1-to-1 when it comes to male and females when it comes to leg cramps. Now, the older you get is the more it occurs. So when you get to 50, over 40% of persons will have leg cramps. And the thing is, George, when you get to between 60 and 80, almost 1 to 2 persons between 60 and 80 report leg cramps to their doctors. Older you get, the worse it gets.
So okay, I've never, let me use my experience and of course those of the elders in my family who I've observed over a period of time. I've never heard anybody complain of a cramp from the foot. Speaking about what the foot is, from the ankle to the toes. I've never heard anybody say there's a cramp there. But the parts of the leg that have, pardon my terminology, doc, but the big muscles, so the calf and the thigh and of course back of the thigh where the hamstring is, those are the areas where people almost always talk about leg cramps. Is
Right.
there science to that?
There is, George. The definition of leg cramps is simply that it is a painful muscle contraction, George, that may be sudden, is usually involuntary, and may involve one or more of some muscle groups. Most of the times, it is present in the calf muscle. As a matter of fact, 80% of the time it affects the calf muscle. But then it can also affect the foot, and we do get the complaints as doctors, and it also affect the thighs. And then for somebody like myself, George, now who sees a lot of athletes, the picture now is going to be significantly skewed.
Yes.
Because 74% of all athletes present with cramps, and therefore we will see a bigger set of persons with the leg cramps. Usually, George, the leg cramps tend to affect sleep, it tends to affect exercise routine, and it tends to affect the general quality of life. One of the reasons why your listeners are going to be very interested in this program, because most of the patients who come to the doctor, who come to me, for example, with persistent leg cramps, not a one-off, George, persistent leg cramps, that is more associated with nighttime, because it can be daytime, nighttime, anytime, or it can be all the time.
Yes.
So for those who tend to have it anytime and all the time, where it is persistent, or for those who have it in the nights, it is usually associated with not only sleep disturbance,
Yes.
George, but a poorer quality of life.
All right. Hold it right there. Let me put this question through to you for you to ponder before I come back. Well, until we come back from the break. The question, we got this one from one of our friends on WhatsApp. I am pregnant and my leg cramps in the night. Feels like I don't even have a leg. What is the cause? That's the question for the doc to answer. On the other side, this is Prescription for Life here on Nationwide 90 FM, brought to you by Suretime Medical.
Suretime Emergency Medical Services, your 24-hour ambulance emergency service and medical center. Visit us at 10 Trafalgar Road, Kingston 5, or call us at 906-SHORE. That's 906-7873. For ambulance services, medical coverage at events and medical house calls. Make your appointment today. Suretime Emergency Medical Services. Worry less and live more. Call 906-SHORE.
With us on Prescription for Life here on Nationwide 90 FM, brought to you with the kind support of Suretime Medical. 906-7873, that's their line. 394-5433, that's their 24-hour lifeline. You can call or WhatsApp them 24 hours. Doesn't matter the time of day or the day, public holiday or otherwise, there's always someone on the other end of the line at Suretime Medical. We're talking about leg cramp, as simple and as basic as that, but as Doc said, it is basic and simple to the extent that it is very common. It is one of the most common complaints, and he's telling us he has told us already what a leg cramp is: a sharp sudden pain in the leg. And Jamaicans, we know how you are between the hip and the toe. You call all of that your foot, but yeah, there's a lot of leg involved in that. Your foot only really starts from your ankle downwards. Before the break, I had pitched a question to Doc from one of our listeners on WhatsApp, and the question was, I'm reading it again: I am pregnant and my leg cramps in the night. Feels like I don't even have a leg. What is the cause? Take it away, Doc.
We like that question, George, because 40% of pregnant women suffer with muscle cramps. And I tell you, 11.6, the caller did come through WhatsApp. I was wishing that the producer could have gotten her on the phone, George, because in the first trimester 11.6%, in the second 28%, 0.2 to be exact, and in the third 50% of pregnant women. It just goes to show that as the pregnancy increases, the fetus, the
Yes.
womb gets bigger,
Yes.
it gets heavier. the belief is that that heavy womb puts a strain on the muscles, and also one of the things we find out that as the womb gets heavier, then a lot of things happen to the foot. For example, the return of blood to the heart will have that heavier womb pressing on it, and so it is reduced, it's delayed, and so circulation is not the way it used to be early in pregnancy. When we come to how it happens, the pathophysiology, while it is largely unknown, I can tell you, George, after studying sports medicine, and when we spoke about what actually causes muscle cramps, and
Yes.
years ago people would say it was lactic acid, and then
Build-up, yes.
and then other people say it's all sort of things. A whole lot of the studies that we looked at as to the cause were still, George, at the inconclusive stage when it comes to the cause. So a lot of the literature will say it is still idiopathic. We know how it happens,
Yes.
we know what happens, but as to the direct cause,
Yes.
it is still out there. And I tell you, George, pregnant women tend to face a lot of muscle cramps. We're not surprised that she's having it. She says she feels as if she has no
leg,
legs.
yeah.
Understand that when it comes to leg cramps, 73% of it is nocturnal, is at night.
Yes.
20% is day and night, and the other 7 is just during the daytime. So nighttime leg cramps has been studied alone, George, in the literature, alone, as a topic by itself outside leg cramps, and it even has a diagnostic criteria. The diagnostic criteria, and I'm talking to this patient who called, whenever you have a nighttime leg cramps, for it to fit the diagnostic criteria for a nocturnal or nighttime leg cramps, 3 things has to happen, George. Number 1,
Yes.
she has to have that sudden painful muscular contraction, and it usually happens either while she's asleep or it wakes her up from sleep. Yeah. Clearly it must happen at nights for it to be nighttime.
Yes.
That's number 2.
Yes.
And number 3, it must disappear whenever she forcefully stretches that affected limb. Now, George, you would have done many football games. You would have seen me running onto the field many times with players who will be having cramps.
For certain.
Yeah. And what you see us do, or you will even see other players do, is that they have the player lay on his back, they keep the knees straight, and they forcefully push the toes down.
Yes.
Right? In medicine, that big word is called dorsiflexion.
Yes.
Yeah, you push the toes down. In other words, you stretch that calf muscle. These studies have been done that shows that is one of the most effective way
Yes.
to release that. And what you do is forcefully stretch the muscle for a couple seconds to release that cramp. That diagnostic criteria is what we're asking this patient who is now listening to us to try. We're saying if it happens in the night, if it happens while you're asleep, or it wakes you up from sleeping, because she did say she feels as if she has no leg,
Yep.
and she's right.
Yep.
Because what happens during that leg cramp is that you're unable to use that affected leg. It's like it is off your body, but you're feeling this very severe pain. And what you want to do to relieve that now, so that you can use that affected leg, is to forcefully stretch the muscle. If that releases it, George, you would have fitted the diagnostic criteria for a nocturnal leg cramp.
Is a leg cramp a static pain or is it a moving pain?
So that's a very good question to ask. So here what happened, how it happens, the pathophysiology. So muscles contract, George, normally when they shorten. So here it is that you have the muscle contracts because of mechanisms within the muscle that allows the muscles to get shorter. And if you should examine, the doctor should examine George, and you, George, can do it. Bugs is having a muscle contraction. You now put your hand on the muscle, and you feel a lot of this, especially out on the field.
Yes.
You feel like there's a knot.
Yes.
There's a knot in
Yeah,
it.
man.
It's hard.
Yep.
It's
Lump.
hard.
Yeah.
Yeah, a bump.
Yeah, man.
Yeah, man.
Yeah.
The muscle is contracting, the muscle is tight, and so the muscle is actively shortening and pulling.
Yeah. I wanted to, before we go further, to ask, to clear this up, because talking about leg cramps, I've seen reference made to, and I've always wanted to know what it is, and I've never checked. I don't know why. So I'm going to know tonight, because I'm going to ask you. What is the relationship between, if any, between leg cramp and restless leg? I don't want to say restless leg syndrome, but restless leg. Is there any relationship between a restless leg and leg cramp?
Well, I tell you something. There is a relation because a lot of persons, I've had 2 patients I'd say over the last 6 months with restless leg syndrome, and this is something that I always wanted to talk about on this program, because many persons, I've seen persons sleeping and you just see them just moving their legs constantly. They're sleeping, they're asleep, but leg is moving.
Country people say a dopey, but carry on.
Exactly. And I was coming to that. You see it especially in the country.
Yes.
But I tell you, the difference is that with restless leg syndrome, you are not, there's no contraction of the muscle. And that's the big difference.
It's just an involuntary movement.
It is an involuntary movement. And as to what causes that movement, well, a lot of that again has not been evaluated, but the contraction is absent.
Doc, we had a caller just now. We're trying to get her back. Charmaine, she's diabetic, and she wants to put a question. Good evening, Charmaine.
Good evening, Doug and Dr. Andre.
Good evening.
Okay, I'm a diabetic. I'm 63 years old. I struggle with a lot of muscle contract at night, especially at the back of the foot. That long boot come up like this, so, and then the front of the leg, front of the same foot, and under the toes, and the fat part of your foot there, so.
Right.
And when I stretch, it bursts.
So I'm so happy for this call, Charmaine. It's an excellent call. And I tell you, George, I wanted her to say that. She said she's diabetic, and I wanted her to tell you what happens when she stretches.
Yes.
I expected her to say, Doc, when I stretch, it don't make a difference.
No difference. It gets worse.
It gets worse.
And put just bend up and thinking, and I have to say, what was sometimes I come to my son at night to come rub it.
To come 90 it for you.
Yes. And him have to use the dietary gel and rub it, and him rub it so hard, and it's still and take it time to feel like something I've got done. You know, if I blood around or something, I can feel something in the foot, and it just takes its time until it just eventually go away. But it don't go away when we stretch it worse.
It's worse, Charmaine just gave you a textbook, George. A textbook description of what we call.
Hold on, Charmaine. The call quality is. Latoya, can you see if we can reconnect this, Mrs. Lawrence? Charmaine, hold the line. My producer's gonna talk to you and see if we can reconnect, because the connection is bad. But we learned a lot there, Doc. We got a lot of information.
Excellent call, George. Excellent call, and thank you for asking Latoya to reconnect it. I expected her to say that, and I wanted her to say that. So you allowed me to define earlier nocturnal cramps.
Yes.
And to give the diagnostic criteria for nocturnal cramps. And to say to our pregnant patient, which is why I wanted her on, to stretch for us and to see if the stretch, or to tell us if she ever stretched and it relieved it. As opposed to Charmaine, and the listeners want to hear this, who is now calling to say, but she's stretching and it is making it worse. So these leg cramps are definitely, even though it happens at nights for her sometimes, it is definitely not nocturnal leg cramps. Very important. One of the big causes of leg cramps is something called peripheral neuropathy. Yes. And when Charmaine is back, if we get her back, you want to ask her about her diabetes and the control of her diabetes.
Yes, I was going to go there.
Yes. What was her last HbA1c? because peripheral neuropathy or destruction of the nerves. You remember Charmaine said she feeling some little things crawling down her legs,
Yes.
running down. She don't know if it's blood or whatsoever. That is what you get in peripheral neuropathy. The diabetics will tell you they feel all sorts of sensations that are not elicited by a stimulus. In other words, they don't see nobody juking them or sticking them, George, but they feel it.
Yeah. Yeah. All right. We're going to take the break and come right back. We're going to get Charmaine back. That's what my producer says. May I remind you that you can go to Suretime Medical, 10 Trafalgar Road, New Kingston, schedule a general doctor's visit. You don't have to schedule. You can just walk in and get the best care. They facilitate night care. They make house calls. They operate a 24-hour ambulance service. And anywhere in the island you can get a Suretime Medical ambulance at your service. All right? Reminding you of those very important things. We take the break. When we come back, we pick up this discussion. We're talking about leg cramps, and we have a caller who we are keen to hear more from.
Suretime Emergency Medical Services, your 24-hour ambulance emergency service and medical center. Visit us at 10 Trafalgar Road, Kingston 5, or call us at 906-SHORE. That's 906-7873. For ambulance services, medical coverage at events and medical house calls. Make your appointment today. Suretime Emergency Medical Services. Worry less and live more. Call 906-SHORE.
We're back on Prescription for Life, brought to you by Suretime Medical. We're talking about leg cramps, and we have a caller on the line, Charmaine, who's sharing her experience, her battles with this very uncomfortable condition. Good evening again, Charmaine.
Good evening again, George. Thank you.
Yeah, man. So we just wanted, is there any specific question you wanted to put to Charmaine?
Definitely, Charmaine. So
Yeah.
I want to know, Charmaine,
Yes,
if you
sir.
have any idea of what your sugar levels are. Things like your HB. You ever hear about something called the HbA1c?
Woman, I do blood tests, but my son tests my sugar for me sometimes. When he tests it, the last time it was 8 point something.
Right.
But I was to do about all I do is test A1C or whatever, but the machine not working, so I never get to do it.
You never got to do it. All right.
Yeah,
So
but I'm a diabetic for quite some time, so about 38 years.
I figured so. And one of the things I want to beg you to do it, to beg your son to, if the machine at the place where you normally go is not working, just ask him to take you to another place where the machine is working and
Okay.
find out what your HbA1c is. It's a very important thing, you see.
Okay.
I'm just going to give you a figure. As a diabetic for 38 years, you want the HbA1c to be 7 or less.
Okay.
You want it to be 7 or less. Now, if it is much more than that, it shows that the sugar is not controlled. But you are having symptoms of what we call peripheral neuropathy, which simply means the nerves not behaving themselves,
Yeah.
the nerves them going bad, and you're also having symptoms of what we call peripheral arterial disease. It just simply means that over time, the blood vessels are becoming blocked up by the damage caused by the sugar, and probably you have high cholesterol too.
No, I don't
Alright.
have that.
You have high blood pressure?
But the pressure always control, but sometimes just sugar bother me.
It's just the sugar bother you.
The pressure isn't the problem, and I don't have cholesterol.
Good. So one of the things we know is that over the years, the pressure and the sugar can cause damage, and even the cholesterol too, even though the cholesterol is not high. One of the things we tend to do as doctors when we see patients who have uncontrolled diabetes and high blood pressure, we tend to still put them on a little cholesterol medication, because we still want to keep the cholesterol fairly low, because we want to prevent it still has potential of doing some damage. But the points you made are very important for the listeners, because the listeners are understanding that leg cramps are caused by now chronic diseases like the same high blood pressure, the same diabetes. For those who have high cholesterol, that can cause it too. And it's very important that you now look at not only your sugar but your heart, because
Yes.
once the legs and the nerves start to behave like that, we figure that the heart can also be behaving badly. So when you go to do those other blood tests, don't forget, if you are not doing it, to look at your heart. You need to look at your heart at least once a year, right?
Yeah, actually, I did it. I did one. Not year before last, I did an art test, and it was perfect.
Yeah. Absolutely. What's your weight, Shannon?
The last time about 140 something.
How and how tall are you?
What, 5'6"?
5'6"? If you're 5'6" and you're
I
1
saw
4.
5'6", 5 something. 5 something. I
You don't
remember.
remember. All right.
5 something.
But if you're 5'6" and you're 140, that's not too bad, right?
Yeah.
But your weight is very important.
I
And
know that. I mean, I usually weigh on 170 hard, and me just go right down and me a complain, say, me lose too much weight, me clothes.
You draw, Charmaine.
Yeah, a long time, I have sugar long time, so I used to have a lot of weight, but the sugar now, me don't have so much weight again, so.
But the sugar, depending on how the sugar is being controlled, Charmaine, sometimes it can cause you to lose a lot of weight.
Okay.
But yes, the sugar can cause that. Sometimes the sugar can cause you to gain weight too. It depends.
Yeah.
But you need to look into that, Charmaine. So I am assuming that you're going to go back to your doctor and you are going to get those tests done. Right, Charmaine?
Okay, now.
Yeah, man. Very important to get them done, and then we can build from there. All right?
One question I'm going to ask.
Yeah, quick one.
That.
Yeah, man.
Why you would gain weight if the sugar is high
That's
or not?
That's a very good question. So some people, Charmaine, gain, some people lose weight, and some people gain weight. Now, the sugar is an amazing thing. Now, even though the sugar is high, Charmaine, people would think that because the sugar is high, they're supposed to get a whole lot of energy, yes? But what is happening with persons who have diabetes is that the sugar is high in the blood, but unfortunately, it cannot get into the cells where it needs to be broken down and converted to energy so that you can have energy.
So it just build up fat.
It is metabolized into fat, and a lot of the energy, a lot of the energy you produce, some sweet smelling things on your breath called ketones, and some of it in your urine, because your body now try to break down this fat for energy and all of that. A lot of persons have this fat being concentrated around their belly, and them have this big. How is your belly? What is your waist?
It's all right. Yes.
Your belly is flat.
Yes.
All right. Well done, Charmaine.
All right, Charmaine, we got to run. All right?
Thank you very much.
You're welcome. All right,
I'll
you're
call back.
welcome. Good.
Okay.
Excellent. All right, so Doc got a chance to deal with a real present issue there based on Charmaine's experience. Well, did I hear you speak about secondary leg cramps earlier?
Yeah, we did.
And
So remember, the primary one is the one we don't know. We
Yes.
don't know the cause. There's a big medical word called idiopathic.
Right.
So the listeners have nationwide, some people would have been exposed to that word before, George. For those who haven't, it just simply means we don't know the meaning. Medicine loves to ascribe very big words to different things, but it just simply means idiopathic. We don't know. So that's a word that allows us to get away with not knowing, right?
Yes.
But secondary and then idiopathic and primary are words that are used together. So primary causes idiopathic.
One and the same.
Secondary means secondary to something else.
Yes.
So secondary to something else, and this is why Charmaine is having a secondary cause, because her leg cramps is secondary to a complication from her diabetes.
Yes.
Which is peripheral arterial disease and peripheral neuropathy. Arteries getting blocked up, nerves getting destroyed.
You know, when I was a lad, I remember there were older women, Doc, who always wore these. Well, they appeared to me to be tight. Maybe those older ladies would say they were snug, but these socks all the way up to just below the knee roll, right? And I was saying, I've always said to myself, well, so when I hear that so and so lady have diabetes and she lose her foot, so I said, well, isn't it that those socks are tight fitting socks more than stockings would affect circulation, and wouldn't circulation wreak havoc with cause pain in the legs, and pain in the legs, leg cramp? Is there a relationship between your socks or stockings and the tightness thereof and you getting leg cramps or being prone to leg cramps as a result?
Well, it is so interesting that you mention socks and stockings, because you are absolutely right. If it is you are wearing very, very tight footwear, one of the ways we treat cramps or address them is to look at your footwear. And we even ask persons who sleep at nights and with the sheets tucked in with their feet covered to actually release that sheet so that it is not tight, because you realize that leg positioning and legs held in a position for a long period of time can result in a cramps. It can result in cramps, even the way you sit. So some people would notice, for example, when you're sitting on the toilet seat, if you sit on the toilet seat for a long period of time, when you get up, because of nerve compression, which is the nerves running down the back of your thighs, it will be compressed, and that compression will cause cramps in the foot. And you'll realize that when you get up off the toilet seat, you have an issue.
Doc,
It's the same thing, Judge. Hold on.
No, I have to say this.
Yeah.
There's a friend of mine from high school who told us a story
Yeah.
of his father in that position. He was doing his morning ablutions, right? So
Yes.
he's there in that position.
Yes.
And the man got up from the toilet seat, tumbled on the ground because his foot cramp up. And we were saying, but don't gag us. So you're saying it's a thing.
No, it's true, man. It's true, especially. I don't know why Books is laughing, but you should ask him. Ask him if he sits on the toilet seat for long times in the morning, and then he can tell us if he gets the cramps. But it's true, because of the nerve compression.
Oh.
So a part of the treatment that you're going to ask me later on, it might as well come now, is that you look at these situations. But there's a second thought, George. This one is very important. A lot of those ladies you see who are wearing these types of long stockings are actually wearing compression stockings, which is something we use as doctors. We prescribe to actually treat circulation problem for the layman, but that the one that has to do with the other side, not we said peripheral arterial disease, but more so the veins. There are many women now who have difficulty with the blood going from the foot back up to the heart, the venous returns. They have what we call venous stasis disease.
Yes.
And these stockings are designed, George, with the pressure being highest towards the ankle, and it gets less and less and less as it goes up to the knee to actually help the circulation up. So these are special stockings that won't cut off the circulation, but actually aid the circulation.
Hear you on that. All right, we're gonna do the treatment after the break, because we are up on the break. We've been talking about leg cramps. No fancy scientific name to attach to the condition. It's just straightforward leg cramps. And as Doc said, it affects a lot of people. And anybody who's been in any family with people older, you can attest to leg cramps affecting grandma, grandpa, daddy, or mommy. And as I said, that story that Craig told us of his father tumbling down repeatedly after spending some time on the toilet, we thought it was gimmicks. We thought, why would you tell a weird story like that? But the boy was right, because Doc says it's a thing. Especially now, Doc, when people are on the social media on their phones and they're on TikTok or whatever and don't realize that they've been there for a long time.
Exactly.
And then they get up and try to get up with 2 feet and realize that it's only 1 foot of work. There you go. We take a break. We come back with more on the home stretch of Prescription for Life here on Nationwide 90 FM. Back with us on Prescription for Life here on Nationwide 90 FM. The we have been doing in recent weeks, listeners, a series of topics that you have recommended. Recall some weeks ago, we invited you to submit the topics that you want discussed based on something that's happening to you or a loved one, or just a topic that you are curious about, have been curious about, and we invited those suggestions. And those are the topics that we've been doing, and we continue to invite you to suggest the topics that you want to hear discussed. You can send the topic of your choice to 394-5433, 394-5433, and we will get the topics done for you. So right, so if you want to hear Doc talk about a topic in his expert way, 394-5433 is the number to punch in. All right, Doc, so let's get to the good part now. Conventional wisdom would say, if you have a leg cramp, elevate the leg. If that is true, why does that simple approach seem to work and work so well?
I'm definitely going to tell you, George. One of the things I want to say, and we will not forget elevation, very important, because that is a part of the treatment, even for the ladies who you saw as a boy, George, in the compression stockings,
yes,
or any stockings at all.
Angine, yes.
The first rule to angine is to elevate the leg. One of the reasons, we'll say quickly, why people have circulation problems is because of restricted blood flow to the area, or inability of the body to get out blood that has already been used. We call it deoxygenated blood, blood with a lot of waste products. We ask your Aunt Jane to elevate her legs because elevating the leg will assist the blood that has already been used with all the bad components, with all the waste products that has also been linked to leg cramps, to be removed from that particular area and for fresh blood to come in.
Yes.
And by doing so, the cramps would go away. The elevation is the first thing we always ask Aunt Jane. The compression stockings is probably the next. The third thing is to address any challenges she have, whether high blood pressure, diabetes, high cholesterol. And then the fourth thing, usually because in these older ladies, it is due to issues with the veins. Many of these ladies will have what we call venous incompetence, which means the challenge with the blood flowing back to the heart is a problem. The fourth thing is sometimes even surgical repair of that particular valve that is not working properly. So the elevation there is very, very important. But what is important every time somebody presents with leg cramps, George, is for us to make a proper diagnosis. We spoke about the diagnostic criteria for nocturnal leg cramps. And it's very important because 73% of persons, we said it before, will present with nighttime cramps, 20 day and night, and 7 daytime. So the other 27% is usually the secondary causes. And earlier you heard one of your callers, Charmaine, I believe it was, who called in, who had a secondary challenge. We must talk to Charmaine. Every time you make a diagnosis in medicine, it involves a proper history, a proper examination, the relevant investigations, and then you try to come up with a diagnosis. You must have a focused history, because in this case, you must talk to the patient. If the patient is an athlete that is running all the time, like my patient who I spoke about when I first started, it was clear why his sodium and his potassium and his chloride was being deleted. He was sweating a lot. Persistent sweating is a big cause. I see the athletes every day on the field, and if they are not only hydrating enough, George, but they are not replacing with electrolytes, they're going to have muscle cramps. So electrolyte imbalance, persistent sweating, excessive exercise, especially if it's high intensity activity, is going to cause that. So that is something that you must look into. So you talk to the person, you have to ask them about chronic illnesses, diabetes, hypertension, high cholesterol, heart disease, peripheral vascular disease and peripheral neuropathy, all of which we spoke about a while ago, Charmaine.
Yes.
So you must ask them, you must take a proper history, because the history is going to clue you into the underlying cause. Your very first WhatsApper was pregnant. And so when my pregnant patients come to me, as I've had probably 2 or 3 the last couple of weeks with leg cramps, it's not surprising.
Yes.
It's not surprising when somebody who drinks alcohol all the time, or who are on diuretics is water tablet.
Yes.
High blood pressure people take it and it send them to the bathroom all the time. It's not surprising to me, because they're going to the bathroom all the time. Alcoholics will tell you, George, that every minute they're going to the bathroom. And so they are going to be passing out a lot. And the question is, are they replacing what they're passing out? It's not surprising if somebody with Parkinson's disease, osteoarthritis, somebody who is on a whole host of medication. George, don't ask me which medication causes muscle cramps. Ask me which medication does not cause muscle cramps.
And why do medications cause muscle cramps?
Yeah, and it's simply because all of them interfere with some parts of the body's normal mechanism, whether it's their electrolytes, whether it's the calcium, the magnesium, the sodium, the potassium, whether it's the energy, the ATP. All of them interfere with something, George, that can result in muscle cramps. And so if patients are on medication, the history must tell us that the patient is on medication.
Yes.
Otherwise, George, you're going to ask them about simple things like leg positioning, how they sit, if they sit for long periods of time, like Bugs, who is sitting most of the time, or if you're an athlete like Bugs, who is playing.
Yes.
It's so important that you examine the patient limbs. Ensure that when you look for normal features and abnormal features. You check the pulses. Charmaine, we definitely need to check Charmaine pulses. We definitely need to do a neurological exam, which means an exam to look at how the nerves are functioning in Charmaine's foot.
Yes.
Because we believe she may have blood vessel and nerve dysfunction. These examinations must be done, and done carefully. You investigate somebody like Charmaine, you want to do her complete blood count, her glucose and cholesterol profile. You want to do her ECG. We spoke about, and I asked her to go do this. Very important, right? You also want to ensure that for others, not necessarily Charmaine, but for others, you may need to do you may have to take it as far as to doing what we call electrophysiological studies. We call some of them, we call them nerve conduction studies.
Yes.
Because some of the times we can't find out what the cause is.
Yes.
And we have to go a little bit further. At the end of the day, George, common things are common. 73% of persons have nocturnal leg cramps. Remember, forcefully stretch the affected muscle. We spoke about what dorsiflexion of the foot was.
Yes.
Stand on the heel, keep the knees straight, lift the toes towards the sky, right? Or if you lay down on your back, somebody can do it for you. Walk on the leg, take a hot shower, have hot water run on the limb for about 5 minutes, or use ice massage. You notice we always have a lot of ice by the sideline.
Yes.
There, George. In football, as you would have seen us doing many times. That's some of the reasons why we have it. If you want to prevent it, exercise daily. The issue is, if you are a patient like Charmaine and we have reason to think that you're having a secondary cause of a leg cramp, which is happening to many Jamaicans, then these complete blood count, where we may find anemia, for example, doing your electrolytes, where we might find low sodium, potassium, chloride, we may find low calcium, low magnesium, doing your cholesterol and glucose profile, which may come back elevated, doing your ECG, which also may come back abnormal. That is reason for the doctor to manage the underlying secondary cause. Very, very important. And a lot of times, George, the leg cramps, even insomnia, because the leg cramps wake people up at night,
Yes.
a lot of persons just present saying they can't sleep.
Can't sleep.
And it's so important for the doctor to look deep into that and ask them, Bugs, why can you not sleep? And then eventually there are 7 reasons for insomnia. We have done it here before, George. The fourth category we looked at was the medical challenges. And that's where things like the restless leg syndrome you mentioned or nocturnal leg cramps would come on, and of course we would go from that and look into the chronic illnesses like the diabetes and the hypertension. Please, we're asking the listeners, don't take the leg cramps for granted, because an underlying secondary cause could be the reason.
Yep, leg cramps could be hiding something far more sinister, and you don't want to be caught out. So if you're having that issue, you need to visit your medic. We are at the end of the program this evening. Thank you so much for staying with us, Doc. A lot of people listen to this show. A lot of my friends from Sportsmax say, yeah man, I listened to you on the Doc last night. I said, you listen to the show? He said, yes. A lot of people, I get stopped and asked about this program a lot more than some other things. And I'm saying, what? Really? Yeah. So you have many fans on the road, Doc, and the people appreciate the way you present your topics. Remember, if you want to really be front and center of the program, all you need to do is just make the suggestion about the topic you want to hear discussed. Send that topic to 394-5433, and our producer, Mrs. Latoya Lawrence, will organize that for you, and Doc and I will be obliged to take care of you with the presentation of that topic. That's the program this evening. I want to thank my producer, Latoya Lawrence. I want to thank the technical maestro, Andrew Anderson. I want to thank Ms. Michelle Dean. I almost said Mrs. Dean, but then she never married to her father or her brother. Doc. Still Miss Dean. Yeah, there are some young men who have a chance. Yeah, only some. Yeah, I want to thank everybody and thank you for listening. Good night.
Prescription for Life was brought to you by Suretime Emergency Medical Services. Worry less, live more. Call 906-SURE.